Hello and welcome to our podcast series, Conversations with KidsPeace. I'm Bob Martin. Here at KidsPeace, we fulfill our mission through what we call our continuum of care. These are a broad range of services to meet the equally diverse needs of kids and families in our area. But how does a family begin their journey towards better mental health, especially when dealing with children in crisis? That's where our program of providing free, no appointment needed professional assessments in our Pennsylvania clinics is filling a growing need. Breannah Allen, program manager at KidsPeace Community Programs, stopped by to give us an update on this capability, which is proving vital to families and young people who are facing challenges and seeking help. Here's our conversation. Breannah Allen, welcome. It's good to see you again. Thank you for being with us.
Yeah, I'm so excited to be here.
Well, we're very excited to talk about this subject of the walk-in assessments. So let's begin with the basics.
Yeah.
What is a walk-in assessment? What happens during one of these sessions?
Yeah. I think the term walk-in is a really great descriptor of the immediacy of the service. It doesn't tell you exactly what's happening when you come in, so I'm really glad to talk about it. So when you come in, when you walk in, what's happening is you're coming in for a level of care assessment. So you're coming in, meeting with a clinician who is going to work with you. And if you've brought your family, if you've brought somebody you're already working with, and they're going to go through a level of care assessment, which really is just an assessment that looks at what's been happening for you in the last 2 to 4 weeks. What are big changes you've experienced? What are the symptoms you've been experiencing? Is there a big spike in symptoms you've been experiencing? What are safety concerns that you've noticed? Are you experiencing suicidal or homicidal thoughts? Are you noticing things that make you worry about your own safety or worry about your ability to get through day to day? We're going to take all of that information, anything that the person who's coming in feels relevant, we're going to take all of that together. And then we're going to review that with our clinical team. And then we're going to make a determination on what is the best level of care for that person in that moment. So it's not providing a mental health service and that we're not starting therapy.
Well, and that's one thing I wanted to mention was like, are there, as you're doing these, are there expectations that people may be bringing to this that reflect a lack of understanding or a misunderstanding of what we're trying to do?
Yeah, absolutely. I think the best way to think of it is thinking of it as triaging. What are the symptoms I'm experiencing and how do I know where I need to get to? So we're pointing you in the right direction. We're not the right direction you need to get to, right? Mm-hmm. But we're pointing you where to go and how to get there, the easiest and simplest way. So yeah, absolutely. Sometimes people come in and maybe they're thinking they might get a psychiatric evaluation, a medication management appointment. They're coming in hoping for a therapy appointment. And that's okay. They come in and we explain what we can provide. And often we're able to meet with them because maybe they've come in because they've lost their psychiatrist. And so then we meet with them and look at what are the things that they've been experiencing recently and get them connected to the best level of care for them. So often, even when people come in expecting one thing, we're able to review what we can provide and still get them connected to the best level of care. But yeah, sometimes people do come in thinking, this is great. I've got, I can come in for a psych eval on demand. And unfortunately, we can't provide that.
Right.
But we do want to get people connected to services as quickly and smoothly as possible. I think one of the things that is really important to us, the mental health system is it's a behemoth. There's so many services out there. Navigating the system as a professional, I've worked in this field for almost 20 years. I still get turned around sometimes. It is so big. It is constantly changing. As a parent, as somebody who has not worked in the field, it is difficult to sometimes even know what to ask for.
Well, especially because when the child is presenting in a crisis, It's not like a physical, they're not coughing, they don't have a green stick fracture of an arm or something like this. Their behavior, I mean, as a parent, I would think I would be freaked out, frankly, with the kinds of behaviors that are presenting in terms of the issues that people are facing. And then you go and say, well, you need to interface with this, part of healthcare that you've never had any experience with as a patient or as a parent. It can be really, I think it can be incredibly intimidating.
Yes.
And that's where the assessments, I think, are, for a lot of people, I imagine they're a godsend.
Yeah. So I hope that they are. And I think that's the feedback that we've gotten. I think that, we offer them for children and adults. And I think that the feedback we've heard is often when you are trying to navigate a big and complicated system for programs that often have wait lists, you don't know the names of programs. You don't know what you're to even ask for.
Right.
It's a really difficult process. And so when you come in for a walk-in, you're not only working with a clinician who knows the programs, who knows not only what they're called and what they provide, but can match them up exactly to the symptoms you're presenting with the level of need that you have, and can tell you exactly what the process looks like to access it. It takes a lot of the guesswork out of the process. It takes a lot of the feeling like you're building the process from scratch out of the work, and it just feels like you're getting connected to care more quickly and more efficiently, and that's what we're trying to do.
And you alluded to something, outside of the purview of the view of the person involved. The information that's coming from the actual interview, so to speak, the assessment, is being evaluated sort of afterwards. What's involved with that process?
Yeah. So what happens is the clinician will meet with the person coming in for a walk-in. It typically takes about 25 to 30 minutes, depending on the information provided and what they're presenting with. They'll then go meet with another member of the clinical team. We review all of our recommendations just because there can be any number of recommendations coming in.
And two heads are always better than one, yes. And another pair of eyes doesn't hurt, and all that.
Yeah. And often these are because this service is available to everybody. It's not just our own clients who we've met with before, who we have clinical histories on. This is everybody in the community is welcome to come for this. And so we want to be extra careful that we're reviewing all of the clinical information that we have carefully. So we review the information with another member of our clinical team. And then we come to an agreement on a clinical recommendation. And then we review that with the family.
Marvelous.
Yeah.
How long have we been doing this now?
11 years.
11
Can you believe
years.
that? It's wild. It's wild. So we've been doing it for 11 years. I think that it has continued to grow in the community. It's been really exciting.
Well, speaking of that, because I think one thing that an advancement over the last year or so that's really amazing is some very tangible support from the community. Can you talk about that?
Yeah, so it's really incredible. So we have some really formal supports from the community. So Lehigh County and Berks County have been incredibly supportive. They've given us financial funding that allows us to keep this completely free of charge. I think that's one of the, there are lots of things I love about this program, but one of my favorite things is that when people come in and they ask how much it is, or they ask what the insurance process is, we get to tell them there's no cost and we don't even need your insurance card. It is really nice to be able to tell somebody that it's one of the few things in this world that there is no cost for, and you don't have to worry about payment. So we are incredibly lucky that both Lehigh County and Berks County have continued to support us and to really support their community members by keeping the service free for their people in their counties.
And one of the things that we always talk about is that this has a great impact on other parts of the healthcare system, specifically.
Yeah, the emergency. So one of the things that we are really committed to is if anytime we're able, if somebody is in a mental health crisis, we want to be able to provide an alternative to them going to the emergency department. So we do that in a couple of ways. We really feel like that's important, not only because emergency departments are already overworked and understaffed. If somebody is in a mental health crisis, sitting in an emergency room for often what happens to our clients for days at a time. It is not uncommon for us to hear about families sitting in the emergency room for 2 or 3 days.
I know that when we first started talking about this many years ago, that was the thing that really just shocked me.
Yeah.
And yet, it's not, it's not common, but it's also not rare.
Yeah,
and I think people don't recognize, because of the way the emergency rooms work, they have to be able to discharge you into some level of care. They can't just simply say, we're too busy for you, go out. We don't want them to do that. And I always say to people, as a layman, I'm hard pressed to find an environment that would be worse for a person who is having a mental health crisis than a hospital emergency room. It's brightly lit. There are people yelling all the time. There are people that are yelling out in pain.
Yeah.
It smells funny. I mean, it's just not a very good environment. But a lot of times families, they don't have an option.
Yes.
They feel now they do.
Yeah, absolutely. So we're able to help in a couple of different ways. So one of the ways that we can help is because we have our own children's hospital, our hospital, inpatient hospital for children and adolescents. We can often do direct admissions, which means that if a family believes that their child meets criteria for a hospitalization, they can come in for a walk-in. And if they do meet criteria, if we believe that they do need inpatient care, instead of going through an emergency room, instead of waiting, we can do a direct admission to our own hospital, which cuts, my gosh, the time period from days to 2 to 3 hours. It's a fraction of the time.
Right.
There are other times when, for whatever reason, if we're not able to do a direct admission, and there are times when we can't, if somebody needs medical clearance, if there's some reason that we can't, we still do everything we can to support the family just to make sure that the child gets to inpatient care as quickly and safely as possible. So that means that our clinical team, when the family is on their way to the emergency room after we've met with them, our clinical team will call over to the hospital and speak with their clinical team. So before the family even gets to the emergency room, we've already provided clinical information. So before the family gets there, the emergency department already knows they're coming, has the clinical background. They understand why our clinicians believe that they need inpatient care. And there's just a much warmer handoff. And the family isn't there just on their own saying, I know my child needs help. Can you just please help us? Where there's a clinician calling on their behalf saying, we have met with them, we've assessed them. This is our clinical recommendation.
It's just a leg up on what we need to do to make sure that person gets the care they need.
Yeah, absolutely.
How many? Do you have a sense of roughly how many assessments we've done in this program?
Yeah, absolutely.
Okay.
So in the last 11 years, we have done just over 7,000. So it's 7,200.
Wow.
Yeah, no, it's incredible.
That
an
is
incredible
wonderful.
Amount of people we've worked with. It's been an incredible amount of just really good work. I'm incredibly proud of the clinicians in our program, and just really happy and grateful for the people in the community who have trusted us and who have come in. I think one of the things that I'm always just continually grateful for, it is incredibly hard to go in and seek out help, particularly if it's a place you've not been to before. I think it's different if it's your primary care doctor you've been to before, it's your church where you're comfortable. Going into a mental health clinic that you've not been to before and saying, I need to talk to somebody, takes an incredible amount of courage and just a willingness to seek out support. And people come to us, and I'm incredibly grateful for that and for the community's trust in us and willingness to come to us for support.
Do you have a favorite story of someone who might have been helped? Obviously, we're not going to identify people, but just something that gives you an idea of what this program is designed to do.
Yeah, absolutely. So I reached, yes, I do. We talk a lot about our walk-ins each week at our clinical meetings. One of the ones that's come up a little bit more recently, we had a family who came in. One of the things that I think KidsPeace does exceptionally well, I'm biased, I think we're wonderful at a lot of things, but one of the things that I think we do exceptionally well is provide care to the youngest of our clients, kids that maybe other hospitals aren't equipped to care for. I think we do an incredible job with that. And we had a family come in with a child who's a lot younger than most places would be willing to provide inpatient care for. They'd been to the emergency room 3 times. They had sat for days, and each time they got sent home. Mm-hmm. And they just, they kept saying that they knew something, they just knew something was wrong. And they came in for a walk-in. They'd been given our information by somebody. They came in for a walk-in, and we were able to get them a direct admission. We were able to get them the inpatient support that they were asking for, that we agreed with them that they absolutely needed. The family was seeking, and they were able to get connected, not just to inpatient care, but then to long-term ongoing support for the family. And it was really incredible because the family just sort of, there was a lot of relief, and there was a lot of hope for ongoing treatment and ongoing things getting better for the future. And we were really grateful to be a part of that.
That's fantastic.
Yeah.
If you were talking to someone who's weighing whether to do this, whether to come in or not, what would you, I'm assuming you would say, hey, come on in. I mean, if you have that concern, but what do you think they could do to make the most out of the experience of the walk-in assessment?
Yeah. So you're right. I would say come in now. If you're waiting, you're only waiting for things to get worse, right? Like you're not waiting and I'm going to wait and things are going to get better and then I'll come in. You're only waiting for things to get worse. It's always better to go in now, because the sooner you have information, you're just coming in for information. It's information gathering. You're finding out what resources you have available to you. And so sometimes when people are nervous, when they're coming in, one of the things we tell them is we're just asking a lot of questions. We're doing a lot of information gathering, and then we're just going to tell you what your options are. It's really just information. The thing that I would tell people to come in with, be thinking about what are the things that have felt the hardest for you. Be thinking about noticing what symptoms have felt like they've gotten worse. So a lot of times, things like depression, things like isolation, things like not enjoying things that you normally like, none of those go from 0 to 100 overnight. They sort of creep up. And so that's part of why we're not asking, how have you been the last 2 days? We're asking, how have you been the last month? Be thinking about, how have things changed over the last couple of weeks for you? And what would you like for things to be like in a couple of months? How would you know if things were getting better? What would you like things to be like? Those are the things that are going to help you sort of identify what are your goals. And coming in with an open mind. It's just, again, it's just information. We just want to be able to let you know what your options are, the easiest and most accessible way to get to them.
Fantastic. Well, you know the drill. You've been with us before.
Yes.
We ask each of our guests to end our conversation with a life hack, favorite saying, inspiration, maybe something, tip around doing something around the house or whatever. So what's your life hack for us today?
So I don't know if it's a life hack, but I really love quotes. And sometimes I'll get stuck on a quote that it sticks with me for a while, and I'll go back to it. And so the one that I've been sort of thinking about a lot and kind of keeping with me quite a lot lately, it's by Arthur Ashe, who's an incredible athlete, an incredible activist. So his quotes, and I'm going to read it so I make sure that I get it right. It's start where you are, use what you have, and do what you can. I think sometimes it's a really common conversation in the clinical field to talk about the sort of enormity of the need versus how much you feel like you can do as a clinician, as an agency. We also have these conversations as parents, as just people in the community. Sometimes it feels like the need is so big. The project, the problem, the issues are so big, and how much you can do feels so small. And so what I have been focusing on myself, and what I've been encouraging my clinicians, but also just in my community, focusing on whatever resources you have around you, starting just with that and just doing the little bit that you can. And so if you feel like the world around you is kind of in chaos, if you feel like your children are in crisis, if you feel like there are big problems that you're dealing with, your job isn't to fix it all overnight. Your job isn't to fix it all completely. Your job is just to get up every day and do a little bit more, and to just kind of keep at it. And so that's been the thing that I've been going back to that has brought me a lot of comfort, and it's been what I've been kind of passing around.
That's great advice. And you find yourself realizing that all of a sudden you've accomplished those tasks or you've met that challenge and you didn't, but if you just sit there and think, oh my gosh, I got to climb that mountain and it's so high. It's like, well, climb the first part, climb the second. And all of a sudden you're standing on the top. So that's wonderful.
Absolutely.
Breannah Allen is program manager of KidsPeace community programs here in Pennsylvania. There's more information about the walk-in assessment program, and you can get that at our website, www.kidspeace.org/walk-ins. Breannah, thank you so much for being with us.
Thank you for having me. It was wonderful to be here.
Awesome. And thank you all for joining us as well. We look forward to having you join us again for more conversations with KidsPeace. Until then, take care.